Non-small cell lung cancer, or NSCLC, accounts for approximately 84% of all lung cancer diagnoses in the U.S. Despite recent advances, management of stage 3 and 4 NSCLC has remained challenging, leading to poor prognosis, high mortality rates, inconsistent patient access to care, and complexity of treatment. Thus, for effective management of patients with NSCLC, most clinical guidelines recommend a multidisciplinary team or MDT approach. However, there is a lack of clarity regarding guidance on the complete care pathway for MDT NSCLC management. For example, current guidelines do not include key aspects of ideal NSCLC care, such as care coordination and patient education, standardized patient participation in shared decision-making, and access to information on financial aspects. Diagnosis, including biomarker testing, staging, and treatment planning, and survivorship. Therefore, to address this gap and to ensure high-quality care for patients with NSCLC, the Association of Community Cancer Centers, ACCC, sought to establish criteria for ideal care incorporating patient and healthcare-centered interventions. An expert committee comprising multidisciplinary specialists and representation from patient advocates and professional associations critically reviewed recent evidence on NSCLC management. Based on this, the committee developed a new framework specific to 4 key phases of the patient journey: diagnosis and biomarker testing, staging and treatment planning, care coordination and patient education, and survivorship. Within these key phases, a total of 32 suggestions for targeting NSCLC care were framed, as well as 9 key recommendations, including the need for an MDT care navigator, patient participation in shared decision-making, and patient education on NSCLC care management. The recommendations emphasized the use of a broader range of molecular tests and multidisciplinary evaluation, MDT coordination for biopsy collection, repeat biopsy plasma testing when required, use of invasive staging procedures, optimal timing of biomarker testing, standardized protocols for short and long-term surveillance, and provision of survivorship care plans. To conclude, these recommendations can lead to high-quality NSCLC care and serve as a useful resource for practitioners to guide multidisciplinary practice and quality improvement.